Welcome to Icon TV News with me, Alfred, in Freetown. And for our news headlines for today. Today is World AIDS Day, and the Chief Medical Officer in Sierra Leone, Dr. Brima Kabo, calls for concerted efforts in containing the spread of HIV and AIDS. President Ernest Bai Koroma reaches Kailaun district on his latest tour of Ebola-stricken areas. And now for the news in detail. In observance of World AIDS Day, which is today, Sierra Leone's Chief Medical Officer, Dr. Brima Kabo, has appealed for a concerted approach in containing the spread of HIV and AIDS. At a news conference by the National AIDS Secretariat in Freetown, Dr. Kabo said the multi-sectoral approach in combating the disease must be sustained. He expressed satisfaction at what he referred to as high political commitment, especially by the present government in the fight against AIDS. Dr. Kabo called for sustained advocacy and used the opportunity to point out that the successes in harnessing the HIV fight can be used in containing Ebola as well. He was hopeful that the next coming months will mark the start in the decline of new AIDS cases. Some 57,000 people are said to be living with HIV and AIDS in Sierra Leone. The infection rate has relatively been stabilized since the 0.2 to 1.5 percentage from 2002 to date. The CEO of the National Ebola Response Center, retired Major Alfred Conteh, says he is pleased with the British support in the fight against Ebola in Sierra Leone. Some civil society activists and local medical personnel have criticized the management at the Kerrytown Ebola Treatment Center outside of Freetown for what they described as their discriminatory policy in admitting patients there. The few beds that are presently available there were said to be reserved for health staff working with British organizations who might be infected. British sources say they are careful not to admit more people there now than they could manage, so as not to endanger the lives of their medical staff. Retired Major Conteh said, "British people are doing a good job which others could not have done." President Ernest Bai Koroma has visited Kailaun in the east of Sierra Leone, his latest tour of Ebola-affected areas in the country. Large crowds of people came out to listen to the president, who encouraged the local leaders to ensure the strict adherence to the bylaws established to stop the spread of Ebola. The district medical officer, James Squire, raised concern at the 56 crossing points along the borders with Guinea and Liberia, of which only 4 are manned by immigration officials and security forces. He said unchecked movements could undermine the Ebola fight. Kailaun District Chairman Alex Bonafà said for the past couple of days, not a single case of Ebola has been reported in the district. President Koroma assured the people that he will discuss the logistics and personnel matters with the National Ebola Response Center. And before we end our news broadcast for today, we bring you our diary for this week. This is a true story. The names, though, have been changed to protect the rights and respect the privacy of the people being mentioned. Alfred is a pharmacist in Freetown with a wife, Hawa, with whom they had 2 children, John, aged 9, and Tina, 5. Alfred has also got a toddler from an extramarital affair. About 2 weeks ago, Hawa became ill and died at home. Just 4 days after Hawa succumbed to her illness, her husband's mistress also died. Young John and his sister Tina were rushed to an Ebola treatment center just outside of the capital, Freetown. There, the children got the care and attention of both local and foreign, mostly British medical staff. The medics liked the brother and sister. A male British doctor became too fond of Tina. She was quite a bright kid with beautiful round eyes. The doctor was contemplating adopting and bringing Tina to Britain. Presently, the aunt who was actually taking care of Tina and John has fallen sick, and so has her teenage son. He has voluntarily reported himself at a treatment center. For now, the toddler from the pharmacist's mistress is okay, and so too is pharmacist Alfred. At the treatment center where they were, the two kids showed some encouraging signs of improvement. Every morning, John will walk over to his sister's bed, wake her up, and the two will go and wash their faces. Last Monday morning, John got up as usual, walked over to his sister's bed. He called out to Tina, but she didn't move. Nurses, struggling to behold the scene, calmly told John that his sister was resting as she had been given sleeping pills. In actual fact, they knew Tina was dead. That's our true story from our diary for this week. And now to end the news, here are the top stories. 57,000 people are said to be living with HIV/AIDS in Sierra Leone as World AIDS Day is observed. President Ernest Bai Koroma has visited Kailaun and assured the people of more support to man the many border crossing points, a cause for the Ebola spread. And that's the end of the news from ICANN TV. This is me, Alfred, in Freetown.